About 71 schools have been shut down for decontamination, and he says that they continue to monitor the situation there very closely to make sure that pupils, as they are going to be phased in, a lot more grades are being phased in, are not going to have their lives at risk, and pleading with people to make sure that when they go to funerals, gatherings, people adhere to safety protocols. Areas like Karankuwa, Mabopane being flagged as one funeral being held there, being responsible for some of the, the infections that Gauteng then continued to see as, we saw an increase. And you'd remember that when you look at the numbers that we got overnight, there's about 8,124 cases that we received overnight. And a lot of these are coming from Gauteng as well. And the number in Gauteng currently standing at 45,944. But right now we are joined by our reporter Mbali, who has been watching this briefing very closely. Mbali, certainly a worrying picture, but it's not one that we did not anticipate, because we have been told, by scientists that we are going to get to this point and we need to prepare for this point. And that is why government then said it needs some time to also look at, making sure that our hospitals are well equipped. Getting a sense today from that briefing that everything is under control?
Well, we can only hope so. We've seen the numbers continues to increase in Gauteng, and of course in South Africa, we're slowly becoming, here in Gauteng, slowly becoming the epicenter basically for COVID-19. And of course we've seen this team of experts coming together trying to sort out what can be done now that we're heading into July, we're heading into August. We know that the health minister has said time and time again that looking into September, it will be the time where we reach our peak. So in terms of what are the plans, basically, Bongiwe, and this is what we've been ascertaining from this briefing. Another issue that has been quite big is the whole issue around, yes, we can see that the numbers are rising. Does Gauteng hospitals have the capacity to actually have more beds installed? Does it have the capacity to have more patients who can be allowed to actually be in hospitals? And this is the sense that we have been getting from the Premier, David Makhura, as well as the Health MEC. They're saying that more beds are being installed. They have saying that, things were under control in June. They can see that the numbers are rising. They've got more beds coming in now in July, and they are, of course, anticipating basically another increase, basically also cautioning people there, saying that they need to be careful in terms of how they behave, because this is a virus that looks at how people essentially behave, that social distancing, people practicing hygiene. You've spoken about how he even mentioned the whole issue around funerals as well. Another thing that he has also talked about is the whole issue around gatherings, looking at specifically protests. We've seen a huge rise in terms of protests in the country, specifically looking at gender-based violence, because we've seen that while under lockdown level 3 and looking at the previous lockdowns, gender-based violence has increased, and this has been alarming for a number of South Africans, Bongiwe. But I'm just going to throw it towards a bite that we've heard from the Premier there, just talking about the issues around, when it comes to planning for Gauteng.
Yes, the system is feeling the stress, and it's not only the system itself in terms of beds, it's also about our staff workers, our healthcare workers, who have day in, day out since the beginning of June, have been beginning to see the numbers increasing. The numbers, like last week when we communicated to you, have been surging up quite sharply, and that have been visible also in terms of the number of admissions that we have had in our facilities, which is something that we'll have to actually reflect on. So what would want to say as Gauteng and also put across to the public is that government also should play a role in calling on the public to play a role in making sure that the system does cope in terms of upholding and respecting the regulations, in terms of staying at home, in terms of making sure that they avoid overcrowded spaces, and also avoiding organizing unnecessary activities which will require people to gather in big numbers, such as some of the marches that we're starting to see, and other activities that we have started to see at the level of weddings, after tears, and all the other social parties.
It certainly does look like Mbali gatherings continue to be the biggest headache, particularly when it comes to going forward. And I mean, this is not new to Gauteng. We also saw that funeral in the Eastern Cape, where that was responsible for so many of the cases. And it does look like government will need to do more when it comes to this issue. But then another issue of great concern here has been, the strain that the trauma wards are starting to see as well.
Of course, and we've seen these numbers increasing just after the lift was, the alcohol ban was lifted. We've seen that just in that weekend there was just a huge spike in terms of the amount of people who then had to be booked into hospital because of these trauma cases. And, our alcohol here seems to be a really big deal. And of course, there was that back and forth coming out from the National Command Council where people have been questioning, well, you are banning cigarettes, what about alcohol? And here you can see that it is causing a strain in hospitals, causing a strain in the healthcare sector right now when we are in need of those beds. And I just want us to listen to Professor Moeng here, where he was basically highlighting, the trauma units and how hectic it has become for healthcare workers in terms of how they can manage the situation, especially when it comes to alcohol.
Now, in the midst of all of these issues and the increasing number, there are two other issues that we are facing that are a problem for all of us. One of them is obviously it's a flu season, and I think the MEC has spoken about that. But the second reality is that unfortunately our emergency department not only are inundated with patients that are coming for acute care, but we are also seeing the trauma load going up more and more with different levels of lockdown. It reminds me of the days when we were doing the 2010, and at that stage one of our trauma numbers had gone down. It was again one of the unbelievable times in this country. May I remind you that this country sees more trauma than what you find in a war-torn area. And unfortunately that trauma is preventable. Most of the trauma we see is related to us. It's related to how we drive on the road. It's related to, unfortunately, also the element of alcohol.